Assalamu alaikum. Today I'm going to read a clinical case number 24, that is a 12-year-old boy who presents with bleeding gums. A 12-year-old boy presents to the emergency department with persistent bleeding from tooth sockets after having two teeth extracted for braces. His medical history reveals that he had significant post-operative bleeding after a tonsillectomy at age 6, with blood staining his pillow each morning for a week. He has no history of excessive bruising or prolonged bleeding from minor cuts. The boy is otherwise healthy but is being treated for severe eczema by a dermatologist. His family history shows that his mother is described as double jointed and has undergone two cesarean sections without bleeding issues. Here, the term double jointed refers to joint hypermobility, meaning the mother has unusually flexible joints that can move beyond the normal range of motion. This can sometimes be associated with connective tissue disorders such as Ehlers-Danlos syndrome. However, since the mother has no history of significant bleeding despite two cesarean sections, it is less likely that a connective tissue disorder with a bleeding component is contributing to the boy's symptoms. However, his maternal grandfather had bleeding problems after two surgeries. His father, who cuts himself daily in his work as a plumber, has no issues with prolonged bleeding. And the boy's siblings are healthy. The investigations reveal important findings that provide clues to the patient's condition. Hemoglobin level is below the normal range, indicating mild anemia. However, anemia is not directly linked to clotting disorders, so this finding may not be central to the bleeding issue but still warrants attention. MCV is on the lower end of normal, indicating microcytic red blood cells. Microcytosis can be associated with conditions like iron deficiency anemia or thalassemia, but it does not explain the bleeding tendency. MCH is within the normal range, meaning the amount of hemoglobin in each red blood cell is adequate. This suggests that despite the low hemoglobin levels, the cells that are present are carrying sufficient hemoglobin. MCHC is normal, showing that the concentration of hemoglobin in red blood cells is appropriate. Again, this does not directly contribute to the patient's bleeding symptoms. White cell count also within the normal range, indicating no evidence of infection or an issue with the immune system that might contribute to the bleeding. Platelets also within the normal range, ruling out thrombocytopenia, meaning the bleeding is likely due to a clotting factor deficiency rather than a platelet related problem. This aligns with the clinical suspicion of hemophilia A or another clotting disorder. The family history of bleeding in the maternal grandfather and the lack of symptoms in the boy's mother, despite undergoing major surgeries, suggest an X linked pattern of inheritance. This makes hemophilia a more likely diagnosis. Hemophilia A, that is factor 8 deficiency, is more common than hemophilia B, that is factor 9 deficiency, with an incidence of 1 in 5,000 compared to 1 in 30,000. The clinical presentation and family history strongly points to mild hemophilia A as the most likely diagnosis. In case of severe hemophilia A, significant bleeding can occur after procedures like dental extractions. The first line treatment for such bleeding episodes is recombinant factor 8, which directly address the underlying deficiency. Here is the first question of this case. What is the most likely diagnosis? Select one answer only. Let's rule out one by one. Number 1, Ehlers-Danlos syndrome. Although the mother is described double jointed, there is no evidence of hypermobility, skin fragility, or poor wound healing in the boy to suggest this diagnosis. Ehlers-Danlos syndrome is also not typically associated with significant bleeding post surgery, but rather issues like vascular fragility. Next option is hemophilia B. Hemophilia B caused by factor 9 deficiency and is much rarer than hemophilia A. While it presents similarly to hemophilia A, the much higher incidence of hemophilia A makes it the more likely diagnosis without laboratory confirmation. Next option is von Willebrand disease. This is the most common inherited bleeding disorder and is autosomal bleeding, for example, nosebleeds, heavy menstruation bleeding, and may cause prolonged APTT. However, the maternal grandfather's history of bleeding but no symptoms in the mother despite major surgeries suggest an X-linked condition like hemophilia rather than an autosomal dominant conditions like von Willebrand disease. Last option is Wiskott-Aldrich syndrome. This involves immunodeficiency, thrombocytopenia, and eczema. The child has eczema but no history of recurrent infections or thrombocytopenia. The platelet count in this case is normal, making Wiskott-Aldrich syndrome unlikely. As we already discussed, most likely diagnosis is hemophilia A. Second question in this case is, which of the following is the most appropriate first line treatment? Select one answer only. Let's rule out one by one. First option is cryoprecipitate. This contains fibrinogen factor 8 and von Willebrand factor. While it was historically used to treat hemophilia A, recombinant factor 8 is now preferred because it is safer, more specific, and does not carry risk of transmitting infection. Next is desmopressin. This medication stimulates the release of stored factor 8 and von Willebrand factor from endothelial cells. It is effective for mild hemophilia A or von Willebrand disease, but is insufficient for managing significant bleeding in severe hemophilia A. Next option is fresh frozen plasma. This contains all clotting factors but is not the first line treatment for hemophilia A due to its non-specificity and risk of fluid overload. Next is recombinant factor 9. This is used for hemophilia B, factor 9 deficiency. Severe hemophilia A is due to factor 8 deficiency. Recombinant factor 8 is the first line treatment for bleeding episodes in hemophilia A because it directly replaces the deficient clotting factor, effectively stopping the bleeding. Thank you so much for watching. This is all about from this case. If you have any question, comment below, like, subscribe and share.